Welcome to our presentation on medication management. Today I'll be discussing new technology to reduce cost and increase efficiency. My name is Dan Grady. I'm a licensed respiratory therapist practicing in North Carolina for about 30 years. In slide 2, I have relationships with CPC Incorporated, Therox Incorporated, Outcome Solutions, and the AARC. For today's presentation, I'll be covering some background related to the issue of medication management and difficulties respiratory therapists especially have had in complying with this standard, current 2011 Joint Commission standards for medication management. I'll be discussing the results of an original research study, and last, I'll be discussing a new solution for meeting these standards, which can save respiratory therapist steps and potential cost savings to hospitals by using this new technology. First, some background. As shown in slide 4, in the past, the Joint Commission cited respiratory therapists for carrying medications in pockets or fanny packs, and the rationale was that medications that were carried in pockets and fanny packs were heated and chemically broke down. And secondly, that the medications were not secure and possibly there were infection control issues. As shown in slide 5, the prohibition against carrying medications in pockets resulted in a lot more time performing high-volume procedures for respiratory therapists, and it required going back and forth to medication storage machines in between patients, which decreased efficiency, required a lot of extra travel time for respiratory therapists, and sometimes it required waiting in line to be able to get medications behind nurses and other healthcare workers who were retrieving medications from a Pyxis machine. Recently, we conducted an original study to determine if RTs carrying meds in their pockets resulted in significant temperature changes when compared to medication temps stored in automated storage machines or Pyxis machines. And I'll be discussing the results of that study very shortly. In the next part of this presentation, I'll be discussing the current 2011 Joint Commission standards for medication management. And these are direct quotes from the electronic version of the Joint Commission manual. First, it says that the hospital stores medications according to manufacturer's recommendations, or in the absence of such, according to pharmacist's instructions. In slide 7, you can see a listing of manufacturing storage recommendations for 5 of the top medications administered by respiratory therapists. And if you take a look at the third column there, where it says manufacturer recommended storage temperature in degrees Fahrenheit, it's important to key on the upper limit that manufacturers recommend for temperature storage of 4 of these 5 top drugs: albuterol, Duaneb, Pulmicort, and Xopenex. The upper limit range for medication storage there is 77 degrees, and it's worth noting 77 degrees because I'll be referring to that a little bit later on in the presentation. Additional Joint Commission standards for medication management are shown in slides 8 and a couple of others beyond slide 8, but slide 8 says the hospital has a written policy addressing the control of medication between receipt by the individual healthcare provider and administration of the medication, which includes safe storage, handling, security, disposition, and return to storage. Slide 9 says that the hospital not only has that policy in writing, but it implements its policy, which addresses the control of medication between receipt and its administration. So basically what these 2 standards address is the requirement that you have to have a written policy, and it has to be implemented to talk about how medications are handled from where they're stored to how they get to the patient. A couple of other relevant standards for medication administration are shown in slides 10 and 11, where it says in slide 10, the hospital reviews the literature and other external sources for new technologies and best practices. And I think it's worth noting here that the definition of secure, according to the Joint Commission, is, in quotes, it's in locked containers, in a locked room, or if it's under constant surveillance, then it's considered secure. Slide 12 shows an additional requirement that the hospital collects data on the performance of its medication management system. And slide 14 says that based on analysis of its data as well as review of the literature for new technologies and best practices, the hospital identifies opportunity for improvement in its medication management system. Hopefully this presentation today will help you to address some opportunities for improvement in your medication management system. As shown in slide 14, and as mentioned previously, we recently conducted a research study for medication and storage and handling by respiratory therapists, and this was called a comparison of methods for medication storage by respiratory therapists. And the abstract of this study is available from the Outcome Solutions website, and that web address is available at the conclusion of this presentation. But essentially what we did was to compare the temperature of 31 saline samples stored in a Pyxis machine compared to 31 samples of saline transported by respiratory therapists, primarily in their pockets, lab coat pockets, or in fanny packs. And we compared the temperature in both groups statistically via a t-test. We presented the results of our study at the AARC International Congress in November 2010, and a paper is in progress of being written and submitted to the Respiratory Care Journal. But here in slide 15, you can see a scattergram of the actual temperature measurements for these two groups. Group 1 was the Pyxis machine. We had 7 different Pyxis machines with 31 saline samples randomly stored in those Pyxis machines, compared to Group 2, the therapist transport group. And what you're seeing in slide 15 is the actual data for these two groups. What's very significant to note here is that although there was no statistically significant difference in mean between the two groups, that it was less than 1 degree when you average the two groups and compare those. Slide 16 shows a summary of this data where both groups are compared, showing the percentage of both groups that had temperature measures greater than the upper limit here of 77 degrees. For the therapist, it was 52% of the 31 samples, and for the Pyxis machine, 48% of the samples had temperatures greater than 77 degrees. So according to the 2011 Joint Commission standards, this wouldn't quite get it in terms of meeting the manufacturer recommendations for storage of meds. So the research study implications, as shown in slide 17 here, indicate, first, Joint Commission will no longer enforce the standard that RTs not carry meds in your pockets. However, per the new 2011 standards, RT departments must have, first of all, a written policy for medication management, and second, you have to produce data showing that meds are within the manufacturer storage guidelines when you take them from a storage machine to a patient. So data must be produced. And this begs the question, how will you comply? I'm pleased to report that there is new technology to help you meet the medication management requirements for Joint Commission by maintaining the temperature of medications between the storage machine and delivery to the patient. And we've developed a novel device for transporting medications which is safe, secure, temperature monitored continuously, allows for multiple medications to be transported, and it's inexpensive, lightweight, and it saves time and respiratory therapist steps back and forth to a storage machine because you can obtain several medications at a time. Slide 19 shows the new technology that's available to help you meet these new requirements. It's a device called the Medipac device, available from IsoThermal Solutions. And the website is shown there, outcomesolutions.net, and it's patent pending. And what you see with this device is that in the center, it has a temperature monitoring strip for continuous display of measured temperature of the medications. One of the things that Joint Commission standards require is data showing that you're meeting the manufacturer storage requirements for medications. Also, this device can be secured with Velcro strips. on either side there, and I'll show how that closes in another view in just a second. And there is a gel pack inserted beneath the medications, which can be refrigerated if you like, to maintain medication temperature. As shown in slide 20, you can see several of the components here. For the Medipac device, there's a SpongeBob Boo Boo Buddy from Walmart that we originally had as the prototype for the gel pack. And again, that can be refrigerated if you prefer. The actual device itself, the Medipac container, has a transparent plastic area where you can barcode scan medications through there. There's a continuous temperature strip available at the bottom, and you can see the temperature highlighted there at 68 degrees. It's a little lighter green color, so you can see that, and I'll show another slide of that in a second. But the Medipac device itself consists of NASA-originated insulative materials to help block heat transfer from the body when medications are carried in this device and then carried in a pocket. It helps to. Slide 21 shows a close-up of the temperature monitoring strip, and here you can see that the measured temperature is 68 degrees, well within the range recommended by manufacturers. Slide 22 shows the results of an additional study that we've recently completed, where we looked at 31 samples in each group and compared the IsoThermal Medipac after an hour of transporting saline samples to the Pyxis storage machine and the therapist transport methods. And what you can see is that the IsoThermal Medipac after 1 hour had 0 of the saline samples outside the recommended storage requirement of 77 degrees. So in other words, 100% of the saline samples carried in the IsoThermal Medipac device were within the manufacturer recommended guidelines. And it's hoped that this data may be useful by departmental managers to show to Joint Commission that they're meeting regulatory requirements. Slide 23 shows a summary of the results for the IsoThermal Medipac device. And two things significantly, we maintain 100% of saline samples transported by RTs for 1 hour within manufacturer recommended guidelines. If you refrigerate the gel pack, it can last up to 6 hours. And second, we achieve statistically significant differences in temperature compared to the Pyxis group and the RT transport group. Slide 24 shows some annualized cost savings that can be achieved by retrieving multiple medications from a storage machine. And the important points here are that when you retrieve multiple medications and carry them in a manner such as the IsoThermal Medipac, which maintains the medications within required storage requirements, you can reduce steps and travel time back and forth to a storage machine. It reduces time in one of our studies by approximately 3 minutes per procedure. And at an 800-bed medical center, our estimated cost savings were around $155,000 per year by improving efficiency, by reducing 3 minutes per procedure for the highest volume procedure performed by the department, in other words. Handheld aerosol therapy is conventionally one of the highest volume procedures performed in respiratory care. We also looked at potential cost savings for 20 other North Carolina hospitals by eliminating 3 minutes per procedure from their high volume procedures and carrying multiple medications at a time. And that equated to $1.6 million per year among the 20 hospitals. So the bottom line here is that great efficiencies can be found by the highest volume procedure in respiratory care, and you can comply with the new medication management requirements of Joint Commission by using the IsoThermal Medipac device. Slide 25 shows the website where this device is available, www.outcomesolutions.net. So thank you for viewing this presentation.